My name na Queen Augustine. Na here dem born me, na here I grow. Na the ama wey me and my friends dey sit down be this. Na where we dey smoke, dey drink, na where we dey live our life. Most of our life na here we don live am. Till police find out say yes, here na jungle wey be say we no dey look people wey dey pass. Till my arrest us, carry us go station. My friend comot from nowhere wey don travel out before. When she come look for us for the jungle, dem tell her say dem don arrest us. She go the station, she bail us. After she bail us finish, she come make some requirements about one organization. Like I said, the organization name na YouthRISE. She carry us go so that we fit learn how to reduce the drugs, and we move. We dey waste most of our time for that side.
We dey pass, sometimes they reach 60, 50 something. We go be like 10, 13, they share syringe, they pop pills, they do things. Sometimes those things, they do some bunch of unhealthy things.
The day I went into labor, I gave birth to the baby, and I was on drug. I was on heroin and pentatozine, codeine and Refnol as at that day. When I went into labor, the baby was not crying. 3 days later, I lost the baby after birth.
It's been 10 years already, and it almost seems unbelievable. Our efforts toward ensuring that the health and human rights of people who use drugs, especially the youth population, are protected and promoted has yielded remarkable results over the last decade.
YouthRISE Nigeria was founded out of necessity. It was an organization that was born out of a need where we saw that the need of young people who use drugs are actually not being attended to within the public health response.
At the time we started, women who use drugs, particularly young women, were rarely reached with information and services in the country.
When YouthRISE Nigeria started, the perception of the society on drug use was rather discriminatory.
But because of the society perspective, sometimes even the parents are even the one that grab their children and force their children into forced rehabilitation. And to some extent, because of the community, intervention to help curb the use of drugs, they're beginning to allow people to set up traditional and local rehabilitation centers that doesn't have the professionals to even manage cases of drug users, that will even bring drug user into, withdrawing and stop the use of drugs. We went to a center in Kaduna where we saw people are chained with chains. Their legs were chained as if they are hardened criminals that were caught during scene of crime.
Specific focus on people who inject drugs and young people were so minimal.
All our efforts have been focusing on general populations. We scale up so many HIV services in the facilities, and we do not see the desirable impact in terms of reduction in HIV prevalence in FCT.
We knew that we had to change the situation, and so we started advocating and providing services specific for these young women, both in terms of HIV, SRH, and GBV.
So YouthRISE actually started a kind of a reform, a revolution, what many people was not ready to identify with. In fact, we had pushbacks even within the public health professionals. That led us to our first report, the maiden report that research evidence that YouthRISE disseminated. We are people looking at the public health and human rights concerns.
This led to YouthRISE Nigeria establishing the first community-based one-stop shop dedicated to people who use drugs to access HIV-related services without stigma.
For so many years, Nigeria has implemented a primitive drug policy, and many other nations globally. Discussions around drug use have always focused on team blaming, arrest, incarceration, criminalization, and so on. Also, responses to drug use have always been about prevention and abstinence-only campaign, thus posing a big gap. The coming of YouthRISE brought a different perspective and narrative to what an effective response should be to drug control in Nigeria.
The coming of YouthRISE 10 years ago and other partners that provide care for key populations started a turning point in our HIV journey in FCT. YouthRISE as an organization has contributed so much in providing targeted, evidence-based program science interventions for key populations in FCT.
I've had the pleasure of knowing YouthRISE from the very beginning, from when it was founded in 2012, even before that, when meetings were being held to get young people involved in the organization. I remember that drug harm reduction in Nigeria happens to be like a strange program. In fact, the acceptability in the society was another issue. YouthRISE, along with some partners, they approach the security agencies as regards to commencement of drug harm reduction.
So we now beginning to build the capacity of that center. We synthesize them. We are doing sensitization and also building capacity of communities for understanding the area of forced rehabilitation does not work for any individual that is drug dependent.
YouthRISE Nigeria mobilized, advocated, and engaged all and sundry for the promotion of harm reduction in Nigeria.
They came to Ministry of Health, and through the effort of YouthRISE and some other partners, the activities on harm reduction commenced.
Narratives centering around public health and human rights were not things that were openly discussed or palatable to law enforcement individuals and stakeholders within the space. This was a big challenge that YouthRISE had to embrace for the context within which the organization was born to begin a response that is different from the norm.
They've done a lot of advocacy on decriminalization. They've done a lot of advocacy on the aspect of ensuring that, drug issues are not treated as war issues, but much more of a supportive, human rights-based approach. And in terms of their impact, I think there is a lot of gain, in terms of policy. We have seen that there is a shift, from the way government look at people who use drugs as criminals. There is a shift, even policies around viral hepatitis, even HIV policy that have now become more responsive to the needs of people who use drugs and people who inject drugs. Currently, there is the drive around harm reduction, which is also something that I think received a boost because of the good work that YouthRISE have been doing in the last 10 years.
YouthRISE was really leading. One of it is the issue of policy dialogue and then mass media management of drug harm reduction. YouthRISE played a major role. And the role YouthRISE played made it rather easy for us to be able to enter into society and for them to accept the program that we refer to as drug harm reduction.
YouthRISE Nigeria also established a female-only drop-in center to respond to the peculiar needs of these young women. We made the DIC like a home away from home.
We've also had people who were able to be reconnected back with their family. We've had people that have been helped in this place during childbirth. We've also had people that have gotten different kinds of orientation, and they are achieving different kind of functioning in the society at this time.
Basically, providing support they need to get back on track. And this, I can say, has brought about tremendous change in their lives.
Many success stories to report, but then just these are just a few of some of the successes we have recorded in this place. Many others, some have been helped with CVs, and then they've used the CV to get jobs, and right now they are doing better than when they came into the center. So that's just some of the successes we've recorded.
We also led the development of the gender component in National Harm Reduction Training Manual.
The role YouthRISE plays in all these activities is really fantastic. And as I'm talking to you now, the pilot program was successful. Even YouthRISE also carried out their own pilot program, which was also successful in collaboration with Federal Ministry of Health.
User, community, networking, and stakeholders consultation meeting in partnership with NACA and UNODC. We are glad to see the progress being made as a country, and we cannot but acknowledge the pride and leadership.
We pushed the boundaries, and our effort was recognized by the United Nations in 2016, when YouthRISE Nigeria was awarded the Red Ribbon Award for promoting a just and equitable society. Our model also got the recognition of the African Union Commission during the Ministers of Health meeting as a best practice to be promoted across the continent.
So, YouthRISE has done tremendously well, that there is no way we can write the history of HIV sector response in FCT without writing in gold YouthRISE contributions.
The impacts of our efforts are in the numbers and quality of life affected directly and indirectly through our advocacy and services.
So thank you very much. On behalf of the Federal Government of Nigeria, we appreciate the activities and the effort of YouthRISE on curbing the drug menace in Nigeria.
Being at the forefront of the drug policy reform in Nigeria, and this is a great achievement, and so glad to see where the organization is at the moment and what the future also holds.
Congratulations for being steadfast, for also contributing in nation building.
We are grateful to everyone who have contributed to this success. Even while we celebrate a decade of impact, we know that there are still milestones to cover. We therefore believe that the past decade is not only a roadmap to what we can achieve, but also a benchmark to measure future success. It's 10 years and counting to us.